So here we have the treatment tray for the preps, onlays and inlays. We have a normal treatment tray with a fast handpiece and a slow handpiece, as well as a burr block. We have the Alginate, which has a scoop. You either do one scoop or two, depending on how big an impression you're doing. You have the mixing spatula, you have the bowl, and you have the measurer. One scoop goes up to the first line, 2 up to the second line, 3 up to the third. We have these scoops as well, which are used for the putty impression material. So we have the Proville Nova, which is used for the private. We have both the catalyst and the base. And we have the Imprec AC, which is used for the NHS. Again, we have the catalyst and the base. We have two different types of trays. We have the half trays, like these two. This one is used for the upper right and the lower left. This one for the lower right and upper left. For these, both of these, if you were using one of these, you'd only use half a scoop of each to mix to go into there. We have the upper and lower trays. This one's the upper, this one's the lower. You also have a handle which goes in like that for the upper, and that way up for the lower. If you were using that size tray, you'd use a whole scoop of each and a whole scoop of each. You'd use for this 2 scoops of Alginate, and for this smaller size, 1 scoop of Alginate. We then have the tray adhesive, which you paint it on to the tray to get the Alginate to stick. We then have the wash. Again, it's the Imprec AC for the NHS patients. For the private patients, it's the Proville Nova. We then have the bite registration, which is the one with the pink tip. And again, it's the Imprec AC. We then have the temporary crown mixture, which is the Uno Temp SC for the NHS patients, and the Lux Temp for the private. If we were doing an onlay or an inlay, we could use clip instead. For that, you will need the UV light and the UV light shield to protect your eyes. We then also have a needle holder, which is used for the anaesthetic. And we have 2 different types of needles. We have the long needle, which is used for an ID block on the lower jaw, so the lower teeth. And we have the short needle, which is used for the upper teeth, as well as the lower anterior. You may also need a cotton wool roll and some articulating paper, as well as a shade guide. You will then need to disinfect your impressions for 10 minutes in the disinfectant powder, which is in here. You then have your lab dockets, so Chapel usually for the NHS, and MV Creations for the private, as well as a plastic bag to put the impressions in.